Our provincial healthcare system is experiencing significant capacity challenges. We continue to do all that we can to increase capacity, particularly in our ICUs where pressure on our staff, physicians, and resources is intense. This afternoon, our ICU capacity is at 87% of all our capacity, including the surge capacity that we have created to date. There are 231 people in ICU. About 70% of these patients have COVID. In the past 7 days, we have added an additional 59 surge beds. We now have a total of 93 surge beds above our baseline of 173 ICU beds. So although we state that we are looking at a current capacity of 87%, remember that this includes surge beds. If we did not create the surge beds, we would be at over 130% capacity. Yeah, so I mean, immediate things that we're doing right now to help create capacity is doing what we're doing, which is around postponing and delaying surgeries. That creates immediate capacity for me.
What I have always done is at every step along the way, I have looked at the evidence that's been available to me. I've consulted with colleagues. In early summer, I did recommend that we move to endemic, partly in consultation with colleagues who are doing similar policy changes with respect to removing public health measures, considering an easing of how we approached COVID, allowing cases to rise with an expectation that hospitalizations would be decoupled. And so again, that recommendation was based on what I had available to me at that time, and based on my belief that that was in the best interests of Albertans in terms of their overall health. Clearly, the move to endemic was too early. We saw early signs of that in early August when we did see trends that were not the same as what our modeling predicted. So the modeling helped us to be able to see that decoupling was not happening in the way that we had anticipated. And we were able to then move the changes later to be able to have more monitoring time. We continued to see that rise, and then I was able to alter my recommendations based on that evidence at that time. It is, of course, up to Albertans to determine where they want to put their trust. All I can do is continue to show up, to continue to do my best every day with my professional judgment, looking at the overall health of Albertans, COVID impacts, the impacts of restrictions, as well as the impacts of many other health issues that Albertans face. And it will be up to Albertans and decision makers to choose how they wish to work with me, but I continue to be committed to the overall health of Albertans and will continue to do my best every day for the province and for the people of this province.
Well, Premier and I have said throughout the last 18 months that we are going to be making decisions that are based on public health and not making these decisions political. And I think, quite frankly, the biggest criticism of us over the last 18 months is that we have not been making our decisions political enough. And we're going to continue to do that and continue to work with Dr. Hinshaw on what our opportunities might be